This crisis has showed the nation we literally couldn't survive without you all. And I mean that sincerely. You've always been essential, even if most of America hasn't learned that term until recently. You've been protecting our communities for months. You're being called on once again as the virus surges across the nation, and I think in each of your areas it's basically doubled in the near term. It's not enough to praise you. We have to protect you. We have to pay you. And you deserve leadership that listens to you and that works as hard for you as you do for the families in your communities, because you are in your own communities. You know the people you're caring for. So I want to hear from you today what's on your mind, what you think is needed most, what I can do as your president to help you and your colleagues in the challenges you have. I'm not going to talk much more, but I'd like to hear from each of you. And then what I'd like to do is maybe ask you some questions and get a little more detail, if that's possible. Is that okay? Doc, how are we doing this?
You're doing perfect. Thank you so much, President-elect Biden. Agree, it's time to hear from our guest. So I'll turn it over to Mr. Tony Murray. Please, Tony, introduce yourself and share with us your experience.
Hello. First of all, thank you, President-elect Biden, and for the opportunity, and Dr. Nunez-Smith, and this great panel of people. It's such an opportunity to talk about our perspective of things. So thank you. So I'm a firefighter and paramedic. I've been in public safety for 26 years. Today I'm speaking to you as the IFF local president for Hamilton County, Indiana, just north of Indianapolis. And happy to provide a perspective here. I'm actually quarantining myself because of potential close contact exposure. So living this, just like so many other people are. As firefighters and EMTs and paramedics, you know, we see America at 2 a.m. We recognize and see that people are struggling. We see this firsthand during this pandemic. We see what people are going through. In 26 years, I have not had the experience that I've experienced through this pandemic in terms of how our response has changed in such a prolonged period of time. Talk about just a concern, a couple things. One is personal protective equipment. This is a concern for the following reasons. You know, one, availability and access from our perspective. Firefighters, EMTs, paramedics, we are most folks' first access to the public health care system. We're treating wherever a person is, whatever they need, and not just because they're sick or with the virus or have symptoms, but whatever the emergency is, we're the first access. We take people in our ambulances and treat them and get them to the hospital system. PPE is so important for our patients, to protect our patients first and foremost. If we're able to protect our patients, we need to then be able to protect ourselves by having access to this equipment. It's so important, it's vital. You know, this stuff is intended for a single use. It's disposable in essence. And we are wearing personal protective equipment sometimes over and over again because we don't have quite the access that we need. You know, it's not intended for reuse. That puts people at risk. That puts our patients at risk and the community at risk. You know, when it comes to PPE stockpiles, you know, those are really have been in this pandemic issued to hospitals and care facilities first, which leaves fire departments and EMS agencies left to the open market to go seek out and find what PPE is available. Obviously, there's a cost to that as well. And we're sort of at a disadvantage from fire department's perspective when we operate in this way, going out into the market. Healthcare systems, they get their PPE by the semi-load. Fire departments are getting PPE what we can get through cases or maybe a skid or something. So PPE is, you know, first and foremost a concern. And as we progress through this pandemic, you know, and we're seeing numbers surge, we're going through more and more PPE. You know, part of the issue here too is that our workspace, wherever we work, is really defined by the emergency. We work in uncontrolled environments. We can't predict where we're going to be working. You know, this virus, respiratory virus, is invisible. We oftentimes we don't know who is positive and who is not. So we treat in every call really by protecting ourselves and protecting our patients. Whether that's Mrs. Smith, who fell down, is not injured, but she can't get family access or has nobody else to call in the middle of the night. She calls the fire department. We show up and put Mrs. Smith back in bed and see what she needs. But we have to wear that personal protective equipment both for Mrs. Smith and for our members. You know, and when you talk about places that we work, you know, it's crawling into the inside of a car that's flipped over on the side of a highway to take care of a mother and her child. That is close contact. You can't get any more close contact than that. Those are the environments that we're working in, which require us to be prepared and have access. You know, frontline healthcare workers, including firefighters, EMTs, paramedics, we're seeing and experiencing increased exposures, increased firefighters, EMS workers who are having to go through quarantine. We're seeing infection rates of our responders increase. This is becoming taxing. We know that. We know that there is hopeful vaccine opportunities, and because of this, you know, we live, you know, as you know, Mr. President-elect, we live communally in the firehouse. We're doing what we can to space and to separate and to alter our meal eating schedules. But every time we get in those rigs to go answer the bell, we're less than 6 feet away from each other. The other concern I would say is that as we go into vaccination, that our workers, our frontline healthcare workers and fire EMS have priority access to a vaccine. I think that's really important and it has to be identified as a resource for us so we can continue to deliver these vital services when people need us the most.
Well, thank you, Tony. Appreciate it, Mr. President. By the way, thanks for this. You're the first one in for me. Seriously. Firefighters been incredible. All right. I'll ask questions after everybody speaks. And by the way, if you see me in your camera looking up, it's because you're on a big screen with me, and they keep telling me to look in the camera. When I look in the camera, I can't see you when you're talking. So I'm not paying attention. There's a great big board in front of me, and Tony's to my left, and Mary, you're my bottom left, and so on. So anyway, I just want you to know that I'm not paying attention.
Thank you for that. So thank you so much, Tony. So now I'll turn it over to Brittany Williams. Please introduce yourself and Brittany and share your insights.
My name is Brittany Williams, and I am a third-generation home care worker, and I'm a proud member of SEIU 775 out of Seattle, Washington. Never before, I understand more than ever the importance of the work that caregivers like myself do. It's one of the fields that was literally birthed out of slavery and bondage. And seeing you, President-elect Biden and President and Vice President-elect Harris, put home care workers as one of your top priorities. It's literally life-changing for home care workers. Thank you. Caregivers, we're the maintainers of life. You have first responders standing that's on the screen for me. But once they take care of those people, it is us, the home care workers, that maintain that care. We have to go in and out of into the elements, going to the pharmacies, going to the grocery stores, to make sure that those people that we care for, because they're more than clients, they become family, make sure that they continue to independence of this. Even before COVID, even before we fought and won PPE in Washington State, caregivers were out there doing what had to be done, and we still are. We have to live with the ideal in the back of our head that because of the job that we do, going in and out of our homes and in and out our clients' homes, taking them to their appointments, pharmacy, like I said earlier, we could become guilty of passing COVID unknowingly. You know, like I said, we continue to do our job because it means so much to us. And as a third generation, it's in my blood. This win is a lot more than just from the face of a caregiver, but I'm also a woman of color and a mother of two beautiful Black children. So for them to see someone in office who has a heart for them and truly understands the importance of rebuilding and bringing back this nation's grandeur, right now we deal with a new situation, a Trump-influenced regime in Congress. And I understand that you have to bring balance with that. My thing is, in the midst of working with that, in the midst of rebuilding this economy, please remember to push forward with the plan that you have eloquently put together, making sure that caregivers' workforce is centered when it comes to rebuilding this nation. And most importantly, making sure that everyone that's in home care and all workers are able to have good, strong unions.
Well, thank you, Brittany, and I promise you, you have my word, I will do that. I've already begun to contact people to how we can put something like that together. My plan, which you know well, the SEIU has been strong on your behalf and behalf of all home care workers, and there's a lot more we have to do. But thank you, and I have a couple questions when we get finished, okay?
Hey, thank you.
Thank you, Brittany. So I'll turn it over now to you, to Mary Turner, to introduce yourself and share with us what you're seeing in the ICU.
Okay. Good afternoon. My name is Mary Turner, and I'm the president of Minnesota Nurses Association, which is an affiliate of the National Nurses United. That's the largest union and professional association of registered nurses in the country. I proudly work as an ICU nurse on the night shift in a COVID unit at North Memorial in Robbinsdale, Minnesota, and I have been since the end of February. Thank you, Mr. President-elect, for inviting us to take part in this roundtable. National Nurses United has been proud to work closely with you, and we so deeply appreciate your commitment to addressing this pandemic and fighting to protect nurses and other frontline workers. Right now, COVID-19 infections are surging across Minnesota and the country. Our hospitals, I tell you, are overflowing with COVID patients, and we aren't prepared. We don't have the necessary resources to keep patients and our workers safe. Nurses, I'm telling you, are feeling extremely anxious right now. We know the right way to battle this virus, but our employers and our government are not supporting us. We're trying to care for patients despite limited supplies, limited staff, and a rapid decline in the hospital beds. And all the while, we know that we could become infected and our families could be infected at any time. The physical impacts of this virus have been devastating. I myself have held the hand of dying patients who are crying out for their family that they can't see. I've taken care of coworkers as they fight for their lives on a ventilator, and knowing that they got sick because of the hospital or their government hasn't protected them. Throughout this pandemic, we've had to reuse N95s so many times. Sometimes the masks literally fall off our faces. In my hospital, we're still reusing N95s 2 times. But I know hospitals that they're still using them 8 to 10 times a shift, 8 to 10 shifts. We can't stay safe when we are using these kind of standards. As a result, nurses are getting sick. A month ago in my hospital, 9 ICU nurses were out with COVID. Just recently, we had 12 emergency room nurses out with COVID. We need to protect our frontline workers so that we can take care of you. Remember, there is no second line of defense. It's us. As president of the Minnesota Nurses Association, I have been on multiple picket lines with frontline healthcare workers who are protesting to get the PPE that they need and other protections. President-elect Biden, there is something seriously wrong when nurses have to take to the streets to beg for protection in the middle of a pandemic. What we're experiencing in Minnesota is what nurses are experiencing all over the country. We're not being given the protection that we need. We need to have optimal PPE for all staff to prevent airborne and droplet transmissions. We need testing of our workers and patients and contact tracing and notification of exposure for healthcare workers. Do you know that I have not been tested yet, and I have been on the front lines in the ICU since February?
You're kidding me.
No. We also need safe staffing of nurses in the hospital units. And patients who are or may be COVID positive patients must be isolated from the general patient population. Workers who have been exposed or who are sick need to be allowed to quarantine at home without fear of losing income in their jobs. This is a novel virus, but the principles of infection control are not. Our hospitals have not been providing these basic protections. This is why it is so critical for the federal, state, and local governments to step in to ensure that nurses are protected. Unfortunately, the federal government has not been there. As a result, the pandemic is surging and frontline workers are getting sick and dying. Nurses across the country were so relieved and grateful, Mr. President-elect, when you committed to taking action that we need to have to get this pandemic under control. Thank you for committing to invoke the Defense Production Act, to increase manufacturing and distribution of PPE, which we need to establish, and also for establishing an OSHA emergency temporary standard on infectious diseases, which could enforce protections we need from our employers. Thank you for that. We are also grateful that you have committed to a robust and comprehensive pandemic stimulus plan to make sure that our patients have the economic support they need. You know, we nurses, we know that we are facing immense death and suffering in the coming weeks, and we will be there. But we need to act now. We need to act quickly to protect our healthcare workers so that we can save as many lives as possible. Thank you.
Mary,
I'm sorry, I'm so emotional.
No.
It's just.
you got me emotional. Look, you know, anyone who spent significant time in ICU like I did for months, you know what I used to do? After I got out, I observed, this is not COVID, but I observed the incredible mental strain on nurses in ICU units. And you know what I did for a long time after I got out? I used to drive back and forth to Wilmington, Delaware. I commuted every day. And, but as vice president, what I would do, I would also, I would go out, back out to Walter Reed on the night shift and bring dinner and food for the nurses and hang out with them. For
The night shift? Cool.
The night shift.
That's cool.
And well, you know, one of the things that one of my neurosurgeons said to me was, You only see people walk out of the ICU. Either they're walking out and they don't ever want to come back because they don't want the memory, or they're carried out and they can't come back. And the psychic remuneration for you guys is missing. You don't see the people you save come back. And
Right.
so I'm sorry for me to get personal about it, but there's a lot that I want to talk with you about. And but I excuse, as we used to say in the Senate, excuse the point of personal privilege here. But thank you for what you do, and all your colleagues, male and female, who are manning those rooms. And now I know we got Patricia's next, and she also is, she's a nurse with the teachers, with students. So and I'm anxious to hear what you have to say, Patricia. They call you Patricia or Pat?
Thank you. Pat is
Pat.
great.
Is that okay, Pat? You can call me Joe.
That's absolutely fine. Yes.
Okay.
Well, first of all, thank you for having me. And also thank you to my colleagues here on this call for sharing. And just know that we're all with you and our thoughts are with you. We're all in this together. And on a positive note, we now have good leadership. And that's going to change things around. That is going to make the difference. I've been a school nurse for my whole life, 38 years. I work in the inner city Cleveland schools where there's 100% poverty and 85% of the children are minority. And I'm also a proud union member of the American Federation of Teachers, where I sit on the executive board as the only nurse. And I like to be at the table as a union member because I like to have a voice. I think we do the work and we should be able to share our voice at the table. And I'm so appreciative of that. I think so much of the problem is that there's been no federal plan, no leadership, and it's really hurt us. Our health department here in Cleveland really is bare bones. It's still bare bones. Our contact tracers are working 24/7, but they're about 4 days out. They're about 4 days from contacting a positive case. So in those 4 days, that positive COVID person has been in the community, maybe with other family members. And I think that has really contributed to the increase in cases. Also, when this first happened, the school nurses got together and our schools closed on March 20th. And we all got together and we got all of our PPE out of schools and we drove it to the hospitals because they needed it. It was the right thing to do. So now as we talk about reopening and going back, we don't have any PPE. Our school buildings, our infrastructure will be in bad shape. We have no ventilation in some of those schools. And you have to remember whatever is going on in the community is going to be going on in the schools. So as long as the numbers are accelerated in the community, we just can't reopen, and we want to reopen. We are remote. The school nurses have set up virtual clinics for all our kids in all our schools. They have our number. They can go on and talk to us virtually anytime. And the one thing that concerns me in talking to all these children is their mental health condition.
Absolutely.
They are really in bad shape. They are traumatized, and I fear for them now, and I fear that when we go back, we won't have the boots on the ground to give them the support. If I could do anything, I would mandate a school nurse in every school every day. And I'm sure Dr. Biden would support me on this as well.
She does.
Teachers need support. Your teacher can't be a psychologist, a counselor. Johnny has a nosebleed and a meltdown, and they are trying to teach. They love to teach. It's what they do. but they can't do it all. And, you know, so many times in the past, they've been demonized, and their evaluations have been based on how students are doing. And it's not fair. They've had value added put into their evaluations many times, and it's just not been fair to them. They do want to teach. They are good at what they do. I think the science has not carried the conversation. When we talk about people wearing masks in public, I really feel like we need to get the science out there more. If we get the science out there, I think the patterns will follow. I think people will be more willing to wear a mask and follow through. But I think the science has been ignored, and I think that's what has caused all the disruption. Oh, let's see. I was fortunate enough to be a part of the Clinton Global Initiative. We went and took care of children in the last hurricane. And I just wanted to say thank you for that as well, because we're about taking care of children everywhere. I'm also worried about the children at the borders right now. AFT went there. We tried to get in. We tried to see some children, and they threw us out. I thought we were going to get arrested, and we never did really get to see how the children were doing. But listen, those are going to be our children. They're going to come into our country. We need to make sure they're healthy, make sure they're immunized. And I would like the opportunity to, as a school nurse, to be able to somehow be a part of that. I think that's about all I had on my list. I hope, you know, school nurses are going to stand ready to help in this, with this vaccine distribution. School nursing has a public health foundation. We've been through smallpox and polio and measles, and actually it was a school nurse that discovered H1N1 in the schools. So we're ready to help. If we could just have some more boots on the ground, we'll do whatever we can do to help you.
Well, thank you all. Let me say a few things, and I want to ask you each specific questions, if I may. And Dr. Nunez-Smith up at Yale knows a great deal about the science, and I could see the look on her face as each of you were talking. It struck her as well. Look, number one, and I am optimistic, but we should be further along. One of the problems that we're having now is the failure of the administration to recognize. The law says that the General Services Administration has a person who recognizes who the winner is, and then they have to have access to all the data and information that the government possesses to be prepared. And it doesn't require there to be an absolute winner. It says the apparent winner, the apparent winner. And we've been unable to get access to the kinds of things we need to know about the depth of the stockpiles. We know there's not much at all. We get to the point where we have a sense of when these vaccines comes out, how they'll be distributed, who'll be first in line, what the plan is. There are over 300 million Americans that are, and beyond our border that are going to have to be taken care of. And there's a whole lot of things that are we just don't have available to us, which unless it's made available soon, we're going to be behind by weeks or months being able to put together the whole initiative relating to the biggest promise we have, with two drug companies coming along and finding 95% effectiveness, efficiency in the vaccines, which is an enormous promise. So I just want to tell you that's the only slowdown right now that we have. We put together, I think, a first-rate team that you would all be proud of. And we're all ready to go and doing an awful lot of work right now. But here's the thing that I want to mention. You know, there's already a circumstance where nationwide, because of the requirement of school districts, county offices, mayors, governors having to balance their budgets, they've already had to lay off 666,000 teachers. 666,000 teachers have been laid off already since March. And I'm worried, Tony, that I know in Noblesville you have a force of about 135 firefighters. And the question is going to be, when do we have to start laying off, because the counties and the cities don't have the money. They can't deficit spend. They have to spend based on balancing their budget. When the first responders and the fire service will be laid off, including all those folks like you who run those emergency ambulances and get people to where they have to get quickly. And so the point I want to make to you is that I was the guy who ran the Recovery Act when we inherited the Great Recession, when we got elected back in 2009. And I was asked to figure out how to distribute, to keep us from going into a depression, $800 billion in 18 months. And I was in constant contact with all the local officials, governors, city, county, all folks, including the various unions you all belong to and the skills that you all possess. And we were able to put, I was able to spend $140 billion on state and local governments to keep you all employed. They didn't get fired, to make sure the fire service maintained its end strength, because the community badly needs to make sure that the nurses, doctors, et cetera, mental health clinics, all were able to stay open, that law enforcement was able to still function, et cetera. And the Congress has already passed that money. It's sitting there. It's available right now. But we're unwilling, some of our friends on the Senate side are unwilling to spend the money. When we talk about states going bankrupt and having to lay off thousands upon thousands of people, one of the leaders on the other side said, well, let the states go bankrupt. Just let them go bankrupt. It's not a responsible position. And I'm hoping that the reason why my friends on the other side have not stepped up to do something is because of their fear of retribution from the president. And hopefully when he's gone, they'll be more willing to do what they know should be done, has to be done, in order to save the communities they live in. And so let me begin by asking you all, and I'd like each of you to give me a brief answer. Tony, how much do you worry about, as a president of the firefighters? Do you worry about the mental health, the need for your employee, your firefighters? And I know it's not something people are comfortable talking about, but mental health is just same as physical health. There is should be no distinction whatsoever, none whatsoever. And just like an awful lot of my son's compatriots who fought with him in Iraq for a year, coming home with PTSD and needing help, but they're trained not to ask for anything. We've got to get by this. Well, I think there's a lot of emergency room nurses. There's a lot of frontline workers.